Hey to all those seeking vibrant health, it's Dr. Rachel Northern here in Johnsburg Chiropractic and Wellness Center. And today I'm talking about what I do to stay healthy. I've been very blessed to keep a really strong immune system, and it just takes work actually. It's not like it just happens to me. First off, as a chiropractor, I do get adjusted. Every 2 weeks is my routine. I know if I do over that or under that, I should say, I don't feel as good. And even if I don't feel anything, I still go and get checked out, and they tend to always find little things they can tweak and make me more vibrant. So I try to trade with another chiropractor or two. I have a couple in my rotation that I see. So I do that. I get a massage once a month. That's how I kind of stay healthy. And then I also do acupuncture about every 6 to 8 weeks for just overall vitality things. So it helps with other internal homeostasis with acupuncture. Those things I do. So I do practice what I preach when I recommend, give you guys recommendations or patients recommendations. And I do know it just helps me. Also, I have a pretty different little bit supplement routine. I'm more robust, and definitely I was going to got a couple supplements out that I kind of definitely take during this time. Orthoimmune by Orthomolecular. They actually came out with this product kind of right after COVID. It has vitamin C, vitamin D, N-acetylcysteine, quercetin, and I'm sure there's zinc as well. So that one I usually take that like one a day for maintenance, kind of off when the weather's not so, if it's good. But then I up it to one twice a day to just give more nutrients for my body, immune system to have the nutrients to fight off. Some other things, some patients I've been definitely recommending more vitamin D, because we're not getting out in the sun. The sun's not been out actually a lot this last couple weeks here. So definitely that's another thing to do, is up your vitamin D during the winter. I have some people that do the blood work every year, and they know they kind of run low. So I'm always saying during the winter, even so, make sure you're getting extra vitamin D. So I generally recommend like 2,000 IUs to 5,000 IUs a day of your vitamin D. Just in general, unless you have, consult your doctor if you have other things going on. Another product I started taking I found last year by Integrative Products, is EHB, which has got elderberry in it, it's got garlic in it, it's got bromelain, it's got golden seal. So it's got a lot of good stuff, a little licorice that helps your adrenals. So this is another one I really been one of my favorites, and I've been taking one of those a day. And let's see, we also have another for patients, vitamin D, or children. We have a chewable from Integrative vitamin D. That's 2,000 IUs on that one. I don't take that one particularly, but that's one I have a lot of patients with the little ones, the kids. That helps them. Another one I've been really starting to take is Mycoactive. This one is actually the mushrooms, like those good anti-cancer, antifungal, all the good stuff, those good mushrooms, turkey tail, and the variety of, pearl, oyster, mushroom, and shiitake. So those are really good mushrooms, and they've been helping patients with, if you got like a cold and a cough that's not going away, that is the one I've been giving people, and that's been like helping resolve the cough if they're like hanging on with that after a cold. And then this time of year, I really my skin starts to dry out. In years past, I'd get so dry that my knuckles would start to crack. And ever since then, I started doing, in the wintertime, I do flaxseed oil B6 by Standard Process. So I make sure to take about, 1,000 to 2,000 milligrams of that. I'd usually about two to four of these a day. And then pair that with Cataplex ACP. ACP is pretty much buckwheat, which is a vitamin C complex. It's got some natural vitamin A, vitamin C, some bioflavonoids, and all the good stuff in that whole complex, vitamin C complex, that we don't get by just taking ascorbic acid by itself. And between those two, it's really good for tissue healing. It's good if you're getting bloody noses this time of year because the furnace is running and it's drying you out. Cataplex ACP really helps with that. So between those, my skin stays nice and, moist, and don't have any problems with the cracking and stuff. And last but not least, one of my other all-time favorite products is my herbal throat spray by Standard Process, which has Like, oh, you know, it's got a bunch of stuff: echinacea, myrrh, clove, sage, marshmallow root. It's herby, but especially if I have a patient that came in and so they just got over a sickness or illness, I'll be like, shh, I'll spray too right then in the office. I keep it on my desk. I'm generally, this time of year, I'm spraying it about 2 to 5 times a day. I keep it on my bedside table too. When I like wake up and you get that dry throat, sometimes maybe in the middle of the night, I'll keep it on the bedside table and do it then too. So that's all the things I do to stay healthy. Also, I do try to make sure I get to the gym and work out at least, 35 to 45 minutes, like 2 to 3 times a week. And also I try to make sure I get like that 7 to 8 hours of sleep a night. So those are the things that I do to try to stay healthy, and that keeps me able to take care of all the patients coming in and not have to like call in sick in my office, which praise the God that I have not had to do that in like 15 years. So take care, y'all.